So this is work that is supported by the patient-led collaboration and the Open Medicine Foundation. And I'll just briefly show some of the team. We've also had some support from the NHLBI. So this is just to show you quickly the histogram of a normal night of sleep. You see that there is, and I don't have a, do I have a?
Green, the green one.
The green one?
No,
That's forward. What's the pointer?
I don't think you have a pointer.
I don't have a pointer. Okay, sorry. Well, you can see that sleep cycles through different stages, and in N2, there's a hallmark EEG morphology that we look for that's called a sleep spindle. And in sleep spindles are thalamic-cortical oscillations, and they occur actually in stage 2 and also in stage 3, which is slow wave sleep. And we've been looking at the spindle morphology, and what you can see here is on the left, a normal, and on the right is more of a pattern that we see in long COVID and also in ME/CFS, where the morphology kind of slops off at the end. So it starts out like a nice tight spindle, and then it changes. And here you see the fast spindles on the bottom and the slower spindles on the top, but particularly in the central electrode placements, you see that the ME/CFS and long COVID participants have a sort of less robust, less defined morphology. We also see that the slow oscillation and the spindle, there is a relationship between the two that is very prototypical. You can see on the top the normal healthy sleeper, and on the bottom two lines or figure sets, part B, you see that the spindle, which is the little star in the middle of the red kind of circle, has moved forward in relation to the slow oscillation. And this is a little signature that we're seeing in those thalamic-cortical spindles in long COVID and ME/CFS. And we know that it is somewhat advanced also in aging, but this is not something we see normally. So what we want to do next is look at the recover data set, where the adult pathobiology recover data set has hundreds of facility sleep studies. We'd like to look there. And we'd also like to try some closed-loop auditory stimulation techniques with collaborators Manoch and Baxter at MGH to see if we could actually move the phase relationship between the slow oscillation and the spindle. So I will stop there. I hope I didn't go too far over time. Thank you.